We're here at CES 2015. We are in the WebMD Wellness Lounge, brought to you by WebMD. And I'm Matthew Holt from Health 2.0 and the Healthcare blog. And I'm here with David Cloud. David is the CEO of the National Sleep Foundation. So David, what is the National Sleep Foundation and why are you here?
Hi, Matthew. Thank you. It's great to be here as well. The National Sleep Foundation is the public-facing organization that represents the sleep community. We are champions for sleep and its relationship to health.
So what do you currently do as services now? And then let's talk a bit about the role of wearables and the explosion in consumer technology in sleep. But tell us what you do right now.
Well, specifically, we create awareness, education. We are also involved in standard setting. We have a partnership with the Consumer Electronics Association in which we're trying to create a first edition of what the sleep wearables standards would be.
So let's talk a little bit about the range of wearables out there and how people are currently tracking their sleep. Are you following trends about how many people are using these wearables to track their sleep? But you've done a lot of work in the sort of sleep research over time. How are those two things fitting together?
Well, it's exciting. There is a lot of great products, a lot of innovation out here that we're extremely excited about, not only on the wrist, but on the bed, in the entire bedroom. And we view that as a really positive first step in an innovation that will continue to evolve over the next 10 years. We would really love to see sleep become a vital sign, and we think that consumer electronics is going to get us there.
So let's talk about sleep as the vital sign. We all hear that we should get 8 hours of sleep a night. We know that some of these wearables that we're seeing on the wrist or in the bed are starting to track, REM sleep versus normal sleep. What is the research that you've done over the last 25 years telling you that we should be doing, and how are you trying to putting that together with the new wearables that we're seeing?
Thanks. Well, we have 50 years worth of research in laboratory setting in which we basically have developed a complete handbook for what these sensors do during sleep. So we can translate from the clinical and laboratory setting into a consumer electronics model, and frankly, the idea of inexpensive sensors, broadband, and computing power makes it very possible for us, and we're excited about the potential for bringing it all together in a bedroom and producing perhaps even other metrics that we hadn't even considered yet in the scientific community.
So let's talk about what you're seeing so far in terms of the measurements that are coming out there and how we're going to get this more standardized so it's more recognized globally so that we're not going from one device to another. We were kind of chatting earlier, I was saying this is a bit like the internet in 1993. What kind of standards are you hoping to promote with CEA?
Well, we're at the early stages of it, so we're pretty close to completing the definition phase, entering into performance standards, and we like what we see. Frankly, there's a very, very responsible group of people that are in this room. It's extremely exciting to see that. It's also interesting to see how the open standards and IPAs are allowing these folks to communicate from one device to another. Very, very exciting stuff. So,
in terms of how people are going to do this, pushing out a few years, do you think that people are going to be wearing devices on themselves? Do you think they're going to be doing stuff by the bedside, or will it actually be part of the bed? I see some bed manufacturers actually here today.
Well, I think it's highly likely that all of the above, and frankly, we think that there's even more opportunities and more sensors, frankly, that could be added to it to create even more robust data and more information back to the consumer.
So sleep is a vital sign, something you brought up. We know that there are some disorders connected to sleep, and that's not something you guys are focused on so much. But tell us a little bit about some of the impact that sleep is going to have on general health and how that's sort of tracking with the other vital signs you're talking about. Give me a sense of how you're working this through.
So it's actually, sleep has three major dimensions. It has sleep duration, the timing of sleep, and the quality of sleep, each of which can be measured, and those metrics can be given feedback back to the individual wearer, and through that, behavior change can occur. We know that people find it easier to track the information because it's passive. It's 8 hours of passive opportunity for us to collect data. And frankly, how that connects into a future role for health and healthcare in general is even more exciting. I think that's the sleep wearables 2.0.
Let's talk about 2.0. Great. So I've been talking to you here we've been talking from the CES 2015 Digital Health Lounge, sponsored by WebMD. And I've been speaking to David Cloud, the CEO of the National Sleep Foundation. David, where can we find you on the web?
Two websites, sleepfoundation.org and sleep.org. Thank you very much.
Thank you.